We're live, ladies.
So I think, Paula, you kick us off whenever you're ready.
Thank you. I always like to wait just for a while so everybody can join. If the attendees can just let us know they're here. Oh, thank you. You can write where you are joining from. Okay. Oh, San Francisco. Good morning. Okay, we have lots of people joining from the US. Thank you so much for spending your mornings with us. Okay, I see the list of attendees is stable now. So I'm just gonna start. Welcome everybody for this hopefully exciting webinar today. My name is Paula Francekovic. I am an education manager at GlycanAge. My role is to help our customers and our clinical partners integrate and understand the GlycanAge test. So if you are interested in talking about the clinical application, feel free to let me know. I'm always open to discussing this. So today I'm joined with our co-founder and CEO, Nicolina Lautz. Nicolina, thank you so much for being here today. So our topic for today is going to be measuring the impact of stress and trauma, glycan-based insights into immune aging and emotional resilience. So this topic is very important for us in GlycanAge, and we have started to notice the signals that impacts of stress and trauma translate into biological aging years ago. Since then, Nicolina, you have traveled the globe. You've spoken to a lot of experts on this subject. You also opened up different research opportunities. I stayed and I collected a few very interesting cases that I will represent today to you. So I also want to use this opportunity to kind of realign and reshare our knowledge, kind of combining these two world findings. So Nicolina, let's start by, I just wanted to ask you, we have been talking about the connection between biological aging and stress and trauma for a while now internally in GlycanAge. But for you, what was kind of the first signal that you personally noticed where you kind of started thinking this could be connected and we could be seeing the impacts in immune system aging of trauma and stress?
Yeah, so I think we'll talk about this study later, but there was the PTSD study, which is all the way from 2013, a very small study, where we see that the patients who were diagnosed were up to 15 years older in glycan aging compared to chronological age. So that was obviously, a real diagnosis. And then because when it went from research to actually meeting the people and having the conversations and finding out about the human on the other side, we realized that we can't really separate psychology from anything else that's going on. So I think this was early 2020. There was a small nutritional study with about 30 people, very tiny, but everybody was perfectly following protocols. And then we had two individuals rapidly increase in a few months. One lady changed by 6 years, another person changed by 7 years. And it was a pilot, so we could communicate, and they're not just dots on the screen. We actually met them, so I sent them an email, and I was like, "What happened in this period? I see the protocol is going well," and both of them said that they just went for divorce. And I think that
I
was
remember that.
yeah, that was the first one. And then obviously I've tracked my GlycanAge for a decade. So I think the first test I did, I was 24. I'm 34 now, 35 this year. So and it was pretty stable I would measure it once or twice per year. And then a couple of years ago, it would rapidly accelerated. And that was a personal stress. So I think with all the work stress, I've been in startup for 15, 16 years, maybe even more now. I got used to the work stress. It wouldn't really impact me. It would have to be something,
That's very strange, I have to say.
yeah, other people, we have other people in the company because I think everybody tracks themselves where they
Yeah,
respond a lot to the work stress.
yeah.
I don't. So I think for me, the personal stress was way more severe. And then so I had the first spike and I thought I was going through kind of a type of burnout, but I was still fully functioning at work. And I started psychotherapy, and then I started to understand that what was happening, I was going through triggers of things that happened in my childhood. So maybe a type of PTSD, but more. So there's this theory, there's a complex type of childhood PTSD. And and that started to make sense as I unpacked it. Of course, I have no actual memories of this because I was such a small child. But I was born in 1991 when the Yugoslavian war started, and my parents were very young. My dad was 20 years old when I was born. My mom was 24, and they had three kids before he was 25. And in my first year, somewhere around 9 months or a year, because they were in a lab in Germany and they were basically ended up, they gave me to my grandparents for a number of weeks. And I was a very small child. And then at 3 years old, when my first brother was born, he was born with a heart condition, a hole in his heart. And he was in the hospital for long stretches. And they were both full in their career. So they left me with grandparents for a year.
Oh,
And
yeah.
and that's a lot for,
For a
at that
small child, yeah.
further my life at 3 years old. So
Yeah.
I had those memories of being abandoned in the way. And
Mm.
then I had like a 10-year acceleration in my GlycanAge after a relationship breakup, where I was actually feeling as if I was reliving that, as if I was a child again, because it felt like there was a risk of dying with the
Mm.
loss of the attachment. And of
Mm.
course, we build our attachment with our
Mm.
parents to start with. So I think that sparked the curiosity because I was tracking it for such a long time, but almost 7, 8, a decade now. And that was the only thing that changed it, despite changes in lifestyle and all kinds of other dynamics. So I think that made me curious. And then
Yeah, that's so interesting, but you seem so knowledgeable about actually defining it. So have you had some psychological support?
yeah, psychotherapy. That's the thing. Because you don't really know what's going on in the moment. And
Yeah.
I think the tendency is not to feel it. And I think my tendency was also not to feel it or to suppress it. And then, I think that's also what drives a lot of people, this kind of unhealthy drive.
Mm.
You can call it immigrant drive or entrepreneurial. It can be, a lot of times I think it comes from not necessarily the healthiest reasons. So I think sitting through it with a therapist, allowing it to come out and realize what it that massively
Yeah.
helped me along the way, and it helped me kind of identify what was going on, and then rationalize it, and realize I'm not a small child
Yeah.
anymore.
So do you think you are kind of in a way cured, or do you think?
No, I don't. Complicated. And no, I think all of us have a lot of different scars, which can be very small. And I think I've had these moments for different things as well throughout life. Without psychotherapy, just something comes out as a type of trigger. Um, so I don't, and of course you can, experience traumatic things later on in life. I think it's just about if you get stuck somewhere,
Mm.
and I think I probably have a lot more areas that I'm still, there's still places to work through.
Yeah.
And
So
yeah.
I've noticed that when we kind of evaluate your results, they sometimes go up and down. So we can still see potentially some, events trigger them yet to this moment, right?
Yeah, no, even in the last year and the year before that as well. And I think, I don't want to make this session about me because we have a
But it's
lot of
very
content.
interesting. It's very interesting. I think a lot of our listeners would be quite interested in, but yeah, whatever you wish to share, it's fine. If you want to kind of move on from that topic, that's also fine. If you want, yeah.
Yeah, I think it's let's go through the whole topic, and then I'm
Yeah.
also open to have a conversation at the end. So if we leave some time for a conversation, I think that's a
Yeah.
way to.
Okay. Well, thank you for sharing this. This is quite interesting to kind of have the signal visible on yourself and then exploring it in other GlycanAge clients, and also for us to be able to communicate that same signal to our clinical partners now. And I would say from my side, I started working in GlycanAge, well, almost 4 years ago now, 3.5 years ago. And those first clients that I got were mostly investors in the company, potential investors, like business-oriented individuals. And sometimes I would notice a steep elevation in their biological age, despite them having generally on paper good lifestyle. They had, access to high nutritious food. They cared about their supplement routine. They were exercising regularly. But our team of specialists, we spend a lot of time talking to our clients, and we sometimes spend even more than an hour trying to figure out what is behind this result. And it became very apparent that those types of clients actually share a similar link. So most of them are these type A personalities, very business driven, very into this grind culture, but skipping a lot of time zones, traveling a lot, disrupting their circadian rhythm, not having the ability to actually switch off their mind, always thinking about the next thing, always thinking about the future. And oftentimes they would also share some feelings of loneliness, some feelings of not having a proper solid community around them. So we can really see that this grind culture actually takes a toll and accelerates the biological aging. And after that moment, we have also seen a more severe case where we would have cases of trauma that already translates into a psychological diagnosis. And I will share a few cases, well, just one case today. But I wanted to kind of wrap up this storytelling session with just communicating the goal of this webinar, which from my side is what I want all of the attendees and listeners to take home with them today is that a lot of our partners and clinical doctors that implement the GlycanAge testing into their clinic actually communicate with us, then in around 70 to 80% of the cases, GlycanAge integrates well with other biomarkers that they use to form the full client clinical profile. However, there is certain amount of cases, around 30 to 20% of the cases, where GlycanAge does not seemingly correlate with other markers. And oftentimes that would be the case where the biological age is elevated, whereas the other markers are showing that everything is fine and this is a healthy individual. What we want to bring up with this topic today is a possibility that this seemingly unexplainable result could be related to unresolved chronic stress and trauma. So for every partner that is listening and potential partner that is listening, please make sure that when you evaluate the results of GlycanAge testing and when you integrate it with the other markers in your practice, make sure to also assess a personal history of mental health, a family history of mental health for that client, and also signs of trauma and chronic stress exposure, a particularly trauma that occurred a few months or a few years before that client actually took the test. So that could potentially bridge the gap and explain this seemingly unexplainable result. And hopefully through this session, you will see what we actually mean and how to potentially recognize those types of glycoprofiles that are related to trauma and chronic stress. Okay, I talked a lot, so Nina, I'll let you take the lead. Recently, you have gave a very nice presentation about a similar topic at Health Optimization Summit. So you've called it From Stress to Strong. So if you can take over and tell us how does this stress actually develop and how do we make ourselves strong again?
Yeah, and I wanted to check, should we work from the same share screen, or do you want me to share screen and then
You can share screen and
yours?
then I can share it later. Yeah.
Let's do that. All right. Okay, everything
Great.
working well? Good.
Yes, I see it.
Okay, so again, I think with inflammation or inflammaging, we're learning that the stress response plays a huge role. And I think actually our glycan research started in that way. Both my parents were in a lab where they were looking at glycans and aging in the brain under stress. So I think it's something that we're going back to now 30 years later. And of course, during time of the Yugoslavian war, PTSD, and stress impacts were a big topic, and I think today it's again becoming but it goes way beyond the impacts of war. So our stress response really is here to keep us alive, or to help us, in the moment, to help us survive a threat, a real threat, ideally, something that's threatening our life. But that comes at a compromise of long-term survival. Because when we're running from an actual threat or we're running from a lion, we don't need to reproduce. So our reproductive system is going to be suppressed, shut down. We don't need our immune system. We don't need to fight cancer. We don't need to fight the bacterial virus, because the idea is for us to preserve energy, put everything into immediate survival for 2 minutes is perfectly fine. But if it goes on for longer, we're chronically suppressing all of these systems. So reproductive, immune, digestive as well. We don't need to digest food when you're running from a lion. And that works really well in the short term. And even short bursts of stress or hormesis is a good thing. But when we get stuck in them long term, then that seems to lead to, well, that compromises our long-term health and kind of, they did references as a survival mode. And what seems to happen, well, first of all, most of stress today is in our mind, because majority of the time our life is not in danger. We might be financially in danger, relationships might be in danger, we might not like our boss, hopefully you guys do, but let me know if you don't.
I
um,
don't
but
know
most
how that, I don't know that feeling, so.
Yeah, most stress is definitely, and you can have the same stressor and different people respond completely differently to it. Same as with kind of entrepreneurial risk. I feel very comfortable with it. Well, a lot of my team doesn't, so I'm pretty sure a lot of my team doesn't like a lot of the challenges we go through. And what we're realizing is that this theory of this connected system of our psychology, nervous system, endocrine system, immunology, or the PNI is a theory that's been researched for a while as a concept of something that's one system keeping balance. And through inflammation, it looks like we might be actually tracking this system that's keeping balance and then leading to inflammation, disease, and mortality in the future. And the first space we saw a lot of signal was hormone related. So we did all the research on the menopause transition, hormone replacement, both in men and women. And these were some of the strongest findings of what would both increase and decrease your GlycanAge. And of course, diets, fasting, everything else also has an impact. But this was one of the first signals we focus on and we saw the most amount of impact. And now psychology is the new kind of direction where we see the most signal and we really want to understand what's going on so that we can start to interpret individual results in the whole concept. Not just because, as you said, you can have perfectly healthy individuals on paper, blood work, lifestyle routine, but they might be suffering with long-term anxiety, depression. These are things that usually won't bring up
Yeah.
on your consult because they're so difficult to talk about. So you might find that out only after you build trust with a client and you get to a stage that they're willing to share. But yes, and then the role of glycans, and I think here we have a lot of people who know us, so I'm not going to go into too much of the basics, but we specialize in measuring glycans on your adaptive immune system or your antibodies. And their role is to activate or suppress inflammation, and in that way they keep we can measure low-grade systemic inflammation, which is independent from acute inflammation. And these are the actual, they regulate our inflammatory response. And of course, they can also be anti-inflammatory. But in general, glycans are like a language. They're a sugar language, but let's not confuse them with a simple sugar. So they have nothing to do with the sugar in my tea and how my proteins will respond to it. They're partially encoded in our DNA. And they evolved to help our biology communicate on a multi-cell level. So every process we have in biology since we've been multi-cell is mediated by glycans. All cells are coated with glycans. They communicate through them. Majority of proteins and also majority of lipids are glycolipids and glycoproteins. And the molecules don't function without the glycan side. So their role is really communication. And I think here we can also not go into too much detail, but these are some examples of the process where glycans will be crucial. And our focus is, of course, on immune communication. And for that, we measure inflammaging, or this loss of the capability of the immune system to regulate inflammation as we age. And it's separate or different to acute inflammation, which is generally a good thing. And then that is a driver of disease in the pre-disease state. So on this level, which would be more molecular before we get to the phenotypic signatures, meaning we can identify which organ doesn't function, because most of our healthcare and most of our focus has been on diseases, but diseases are endpoints and they're common molecular drivers, which are leading to that way before we get to symptoms or a disease you can identify. And this is why a patient could have perfect blood work, everything looks normal from a traditional clinical picture, but on a molecular level, there's low-grade chronic inflammation that's starting, and the longer it's there, the more it becomes a health hazard. So when we look at this one biomarker, so glycans on your IgG glycom, these are over 300 different studies. We've connected it to over 72 different diseases, where you can also see different glycosylation patterns. So you can distinguish different type of immune diseases, but also categories, so autoimmunity, neurological disease, all of it looks distinctly different when you look at the glycan patterns. So everything around the edges of this circle, if you see blue, that means high abundance of a certain glycan, low abundance of a certain glycan, red is high abundance, and if it's white, there was no association. So you have one mechanism which so far we know is implicated in 70 plus diseases, and this is just one glycoprotein. And in this way, we can stop thinking about disease as kind of an endpoint or one disease and start to think about mechanistic drivers which may lead to many different diseases. And we see that that happens a long, long time prior to symptoms and diagnosis. So these are all longitudinal studies where we have patients when they're healthy, and then you have time to an event, heart attack, stroke, diabetes diagnosis, insulin resistance. And these are how many years in advance we would see changes in their glycemic profile. And then you have the performance in terms of accuracy on that. So it's usually 5, 7, 10 years prior to the routine clinical picture changing and you being able to diagnose a patient with insulin resistance or them having a certain event. Now, I think I leave it to you. Should I stop sharing my screen and you take over?
I can reshare. Okay. Well, that was quick and informative. Thank you. So I really like that part when you talked about the psychoneuroimmunological pathway and what we have discovered in the endocrine system. Now we are trying to also discover the psychological impacts of biological aging. And I always like to say that, for example, when we are focused on disease treatment, we want to be as precise as possible. So, for example, if we are treating cancer, we want to target that particular receptor on that particular cell. However, in this preventative mindset, preventative space, where glycans lie, where the disease didn't start to develop yet, we want to think about systems. And this is where this psychoneuroimmunological super system is very valuable, because glycans seem to be the biomarkers of the whole super system balance. So they're not only showing your endocrine health, but they're showing an all-encompassing number of the whole system. Is it functioning? So is your sympathetic and parasympathetic nervous system communicating in a proper way with the immune system and with the endocrine system? So what I want to do with my part of the webinar is go through a few cases, so you will see how this trauma and stress can be seen in the GlycanAge report. Before I actually show you the cases, I have a few important points to make. So first one is a point about relating GlycanAge's biological age to mortality. And this is what we are focused on heavily these days. And we have published 3 large-scale studies, and some of them are in the process of being published at the moment because it's such a fresh data point. But biological age testing without an association with mortality is practically useless. So we wanted to have black and white evidence that the biological age testing that we are evaluating correlates with mortality and can be a good predictive measure. So this is an excerpt from the first study, where we have shown that if you combine chronological age of a person, classical blood work biomarkers, and put GlycanAge insights on top of that, you get the greatest health span and lifespan prediction. So that's very important, because you can see that the glycan analysis can add additional value to your practice, particularly if your practice is focused on prevention and healthy longevity. Another cue comes from another study where we have shown that, well, it's a little bit of a depressing data point, at least for us that have elevated biological aging, that we have shown that with one biological age increase, we see around 7% increase in mortality. So for every year above your chronological age, you get a higher risk of mortality, and that is in men, 2% in women. So we also see a gender-specific, sex-specific trend, and the aging curve is, again, we can go into conversations about the bursts of aging. Women tend to age more slowly up until the end that they reach perimenopause and menopause. Then their aging curve starts to increase again, but that's a topic for another webinar. And the last study comes from the longitudinal outcome study, where we have shown that the glycoprofile that is pro-inflammatory, that is filled with glycans associated with mature age, is predictive, and it's correlated with cases of mortality and dementia. So that's very relevant for you to understand that this biological aging increase can have consequences on the mortality and on the disease risk. Yeah, Nicolina, do you want to say something?
So I think just want to mention these are all the 3 mortality cohorts are independent, because we had previous prediction of mortality and lifespan, but these are independent and looking at mortality risk on the level of individual, not a cohort. So this is first proof we have with aging clocks that they can predict mortality not just on larger cohorts, but also on the level of an individual. And the mortality, the one you were showing previously, it's independent of BMI, smoking, blood
Oh, yeah.
pressure, LDL. So all of these known mortality risk factors have been removed to look what is the mortality prediction that's separate to what we can evaluate today. And it's a completely independent prediction of all-cause mortality.
Thank you for sharing this. This is very important that this is on an individual level, because that leads me to my next point nicely. So this is a slide representing a third-party analysis where Jamie Haywood and his scientific team wanted to find the best biological age test to use in their scientific studies, and they compared the GlycanAge testing with other biological age tests on the market. What they found is that GlycanAge is virtually the only one that can predict individual level risk. So it's appropriate to be used on an individual level. For all of the others that they compared with, they found very big variation on an individual level. Sometimes even plus or minus 10 years variation in the same day. GlycanAge, on the other hand, showed great technical reproducibility and very low variation, plus or minus 9 years, plus or minus 1 year, I apologize. So what they concluded from this is that GlycanAge the biological age is very stable when the physiology is stable. But what they also saw is with the repeated measurements, when they try to change something in their lifestyle and in their diet, the biological age was responsive to this biological changes. So they concluded it's the ideal tool to use for their purposes, for their longitudinal follow-up on an individual level. So the other tests, biological age tests, are also good when you have cohort level research studies, but they may not be fully ready to be used on an individual patient. So what we also know is that changes in the IgG glycans consistently precede diagnosis of cardiometabolic diseases, autoimmune diseases, hormonal decline, as Nina mentioned before, and this psychological and mental burden that we will discuss today. So you can use GlycanAge testing as both a risk predictor and a response tracker. So if you want to introduce a preventative protocol, you can track before and after this protocol to see is it truly showing any benefits. Okay, now that we talked about mortality, now that we talked about variability, I think it's important. So one of my goals with this was to show you that we are very confident if we actually see a change in the result that this is a true biological change. And without that, we wouldn't have the whole clinical implementation arm. But we are, gathering more and more evidence from both research and practice to be more and more sure of that. And let me start by describing the cases. So I will start describing this first one, and then I will allow Nina to also show a few cases herself. So this first case is an active male client of ours that we have tracked for many years now. So as you can see here, below line is his chronological age, and above is the biological age. So this client, when he started measuring, he actually didn't report any diagnosis. He was otherwise active. He had good body composition to start with, unimpressive blood biomarkers, so nothing out of the ordinary. You can see his training routine. You can see his supplementation that was constant throughout the measurement period. So he's a creature of habit, and when he found what is working for him, he is sticking to this. So at the first glance, his biological age result didn't make much of a sense, but he continued to be curious, and he continued to measure frequently the biological age. And when we started talking, when we started to collaborate, this client started to open up, and he shared that he's been dealing with a combination of anxiety and depressive disorder. And he's been treated with the SSRI medication throughout the measurements. So even before his first measurement, he was already on those medications. So years have passed. And what is very interesting, when he was 43, he was diagnosed with kidney stones and suffered a lot of pain related to these kidney stones, which is a very important cue because you can kind of see that the glycans were the first biomarkers that would actually show a potential danger that actually turned out to be true in his life. And you can also see some indications that the mental state is also related to the metabolic health. We will discuss this in a little bit later case. But what I wanted to share with you is his latest result, which came as a massive surprise to all of us. His biological age actually dropped significantly and was 45, so very close to his chronological age. And that drop occurred about 6 months after his divorce. That was very interesting and not expected, I would say. But in the communication with the client, what stayed in my head particularly were two things he shared. First, after all of the drama from a divorce settled, he said to me, Paula, I think I don't wake up with a cramp in my stomach anymore. I kind of had it throughout these years, and I thought this was normal. This was a normal feeling. I don't have that anymore. I wake up normally, feeling like a normal person. And another thing he shared with me is when he married first, they got a dog. And that dog always had a very anxious personality, always barking a lot, never settled, never calm. After a divorce, it felt like he got a new dog. So the dog was calm. The dog was a totally different personality. So that kind of goes to show you that the dog could also sense this anxiety and this electric environment. And without it, the dog could also be calm, the same as the client. So we are going to continue measuring. This is our first signal. We are still not sure if this is a stable decrease, if this is going to stay like that, or is it going to increase again, given the client has an anxiety depressive disorder. So, but we are going to keep a watchful eye on what comes next. What I wanted to share related to this diagnosis is a study that we have conducted trying to map out the IgG glycan patterns that are associated with these major depressive disorders. So we conducted a small study on 18 patients with major depressive disorder, and they measured their GlycanAge at a baseline and 6 weeks after they have started an antidepressant treatment. Unfortunately, that treatment was mixed, so we didn't actually control for the type of medication that they were receiving. But still, we managed to get some nice early signals. So what we found is that this particular branched glycans correlated with the symptom severity. We have also found that there is a female-specific IgG glycan pattern that could be predictive of treatment response. We also saw that some people were good responders to the treatment, some not so good, and the ones that were good responders actually had a change in this endoplasmic reticulum to Golgi apparatus trafficking, which is a sign of a changed immune function. So we are just starting to map out the immune system mechanisms that could be related to depressive symptoms. So that's a very interesting first signal. Of course, more studies are needed, but we have shown that the glycan patterns can be quite an interesting biomarkers for predicting is a person going to be a good responder for the antidepressive treatments or not. And related to this, while I was preparing for today's webinar, I actually came across this very interesting article that was published just a few days ago. That shows that immune system and metabolic dysregulation actually predates a diagnosis of a depressive disorder. So what is very interesting about this, so they used, this study group used the UK Biobank cohort as well. They used these longitudinal measurements, and they focused on the differences between healthy individuals, the ones that have a depression as a diagnosis, and the ones that have this prodromal depression. So that's a state where you have mixed symptoms that lead to a depressive diagnosis, but it's still not classified as like the classical depression. So what they found is that they had persistent systemic inflammatory markers. They also had disruptions in their lipid profiles and disruptions in their glucose pathways, which preceded the diagnosis of a depression. So the conclusion for this is that potentially, if we can detect the chronic inflammatory pathways early, and we can detect the disruption in those pathways, we can actually address for that, prevent it, and prevent potential future of depression. And that's very, very important for GlycanAge, because I wish that they use the glycan profiling as well in the studies, because they would have an even better metric of this low-grade chronic inflammatory process. But another point here is important to make. So I told you about a case of anxiety with depression. I told you about this connection between the immune system and the metabolic state with cases of depression. And this is very important for clinical application and clinical understanding of the GlycanAge results. So this is a typical slide that I share in the clinical education session. This is a nice map of the influencing factors that majorly influence the GlycanAge results. So Nina, in the beginning, mentioned also this endocrine drivers. We also have this inflammatory and disease drivers. So if we have cases of autoimmunity, we would also see some changes in the glycan profiles. And lastly, we have this psychoneuroendocrine driver, which is driven by circadian disruption, trauma, chronic stress exposure, workload, social isolation, mood disorders, everything that we have mentioned here. And it is classified. So what would we expect to see in the results is with this, we would expect to see an elevation in the biological age. However, we would expect to see a significant pattern, distinct glycan pattern, which is classified by reduced G2. So that in the report is glycan youth. So those are degalactosylated glycan structures that we would typically associate with younger and healthy immune system glycoprofile. We would also see an increase in the glycan mature structures. So G0 is the kind of scientific name. These structures are pro-inflammatory glycan structures, and they are seen in abundance in older individuals and in glycoprofiles that lead to a disease. Sometimes we would also see a bisecting glycan increase. And this is what we came to classify as the manager's profile, because it's so commonly seen in people who are, these busy entrepreneurial type A personalities. But it can also be recognized in people with mood disorders, and the profile is going to be more severe in those cases. What I wanted to emphasize here is that the same pattern is also seen with metabolic disturbances. So people who have insulin resistance, who have hypertension, who have diagnosis of metabolic syndrome also show the same pattern. This kind of goes to show you how sometimes our mind can trigger our immune system to be disrupted, which can translate into a metabolic disease in the future. So all of the people that have this disruption, whether it's driven by trauma, chronic stress or another driver have elevated risks for these metabolic conditions in the future. And this is also apparent from our first case, where you can see the buildup of kidney stones as a consequence of this pro-inflammatory, chronic inflammatory environment. And this is an example of the manager's profile. I just wanted to show you how this pattern looks like in practice and what to expect, so you can right away see it. In the new report, we have indications already. So when this profile is seen, we already have an indication that guides you through that this is possibly the manager's profile, and that you should evaluate the emotional and mental well-being of that individual. So here we have an example of a 32-year-old male business professional, actually a founder of a startup with a biological age of 60. So he reports chronic stress, poor sleep, circadian disruption because of traveling a lot. He really fits into this grind culture mindset. He also started to show some clinical signs of metabolic and hormonal imbalance that would otherwise go unnoticed. But now in this context, he is trying to address them. So for example, he had some thyroid issues that signify like hypothyroidic state. And he also showed suboptimal levels of free testosterone that would otherwise be untreated and kind of left on the sidelines, but now seem important cues to kind of fill in the gaps, to fill in this picture that is driven by this chronic stress environment. And I wanted to just point out that this is a classical thing. So what drives the overall increase in the biological age is this pattern. So low glycan yield, so low degalactosylated glycan quantity, and high pro-inflammatory glycan load. So this is a classical pattern, whereas the other indexes may or may not be severely disrupted. Okay, I will stop the sharing now, and Nicolina, allow you to reshare again. So you also have an interesting case to share with us.
Yeah, I was thinking actually we can stay on your one
Oh,
because it's
okay.
only 2 slides.
Yes.
Yeah.
Okay.
Yeah, let's give it a second. Yeah, and I think I see a lot of comments on selling startups, getting divorced, all of that. And I think the thing I like to say is that either you have to remove the stress or you have to get better at the stress or even resolve it, because again, it's in your mind and it's hard, but you can change your mind. So I think there's a lot of founders who do really well with the startup stress, and there's a lot of couples who have no, they have lots of peace.
Yeah.
Okay, so this client, I'll try and give a little bit of background. So we've tracked him only for a couple of years now. And on history, sometimes around teenage, so this is 22 years ago, he had a drug-induced psychosis that lasted a few years and then went away. Now, he had a turbulent marriage, and I think if we looked at him in the years before, you probably would have looked like client number one, where there's a lot of stress, and it wasn't getting resolved, so divorce happened. And then here he's in a new relationship, and first there's an improvement, and then he's followed every couple of months, and then there's a high elevation. Now, what happened, this was a trigger of PTSD, or PTSD back from teenage. And usually, so what he was explaining is that all the way previously, he felt that there was this invisible abuser that was kind of always there, and particularly would, kind of become visible in intimate relationships because they're the closest to you. And then he started to remember what happened, and he started doing psychotherapy, and this is and actually a particular type of psychotherapy, the internal family systems. which also we're very keen to do research on all modalities of psychotherapy. But I think particularly internal family system seems like an area that's worth exploring from a research perspective. So what happened, he didn't know what triggered the psychosis, and the theory was that it was drug-induced, and actually it was a sleeping pill that was the main trigger. But what happened before, for a period of time, he was drugged and sexually abused with a rape drug. And that it was that then probably led to the psychosis with the sleeping pill because it imitated some of the effects of the rape drug. And then these memories only became apparent 22 years later. So this is 22 years not knowing that something had actually, and of course, these memories, it's very blurry. You can't really fully describe. And but what I think is going on, I think the close or this emotional stress that often get triggered in intimate relationships brings out certain traumas, which then trigger this fight or flight as if that event from the past was happening again. And then either couples get stuck or they manage to resolve it and they go back to a healthy baseline. So I think it's fascinating that if we look at the first case, and if we correlate it to the mortality, the independent mortality prediction, that would have been almost 300% increase in all-cause mortality from relational stress, and then a decrease. But what's interesting, this client, there's no breakup of the relationship. That's actually resolution of what's causing the stressor. So I think that this area is something that we really want to explore further, and it's something that we never thought about as something that would affect the results or something that we should be talking about, but or that we should be asking about in some way. It's incredibly personal. Does it really affect your health so deeply? But then if we look at the longest longevity studies we have, there's not many because they run for 50, 60, 70 years. And there's that Harvard study of happiness where which ended up being a longevity study where they see that the biggest predictor of both quality in life and life expectancy was actually the quality of relationships. Doesn't need to be, an intimate partner, just general quality of relationships. So if we go to the next slide, this is the PTSD study. So it's a very small study done years ago. But what was found is that with clients, and this is war-related PTSD, but in these clients, they were about 15 years older. And even the clients who had mild trauma, but were not officially diagnosed with PTSD, you can see an altered profile. So again, their GlycanAge would be accelerated, and the control had a healthy baseline. So far, from a research perspective, again, this is 13 individuals, so it's an incredibly small study for science. But from a research perspective, we don't have any resolution for, we don't have any studies on stress interventions that move GlycanAge backwards. We have lots of individuals, we have lots of case studies, and Paolo will show you more. But what we want to do, we want to accelerate the space of research and do proper research, of course, starting with smaller studies to see what interventions do we have for stress. And that could be work stress, but hopefully not needing to change your job. It can be relational stress, but hopefully not needing to get divorced. What resolutions do we have to change your response to the stressor versus remove the stress? Sometimes it's necessary to remove it, but yeah, I think we can have even better interventions. So I think if you go next slide, this might be for you to take on. Yep.
Yes, thank you. Yeah, and I think finding the solutions is very important because we have discovered this way of actually evaluating the impact of chronic stress and trauma on the immune system. But do we just leave people with that knowledge? I don't think that's in our interest. So we would definitely want to start developing, of course, if somebody is willing to collaborate, developing a preventative protocol that can actually help them reduce their biological age and reduce the risk of their mortality that is driven by stress and trauma. I wanted to just finish this webinar with a positive example although you can consider the case one to be a positive as well. And this is one of my clients, a female client that is now 39 years old. And I've spoken to her first time actually after her second test. And she was very confused. She told me, why did I have such a steep drop in the biological age? I didn't change anything. She said her diet routine is the same, her exercise routine is the same, her environment is the same, so she didn't move or anything like that. And I was aware of the psychoneuroimmunological link to the biological aging, and I immediately asked her, do you perhaps have a new person in your life? Do you have some new relationship? Did you change something professionally or personally? And she said, well, actually, now that I think about it, I changed my job. I quit my corporate job and I started a solo entrepreneurial career. And she said this with such a spark that I immediately known that this is definitely related to the drop in the result. So her happiness about this decision is not only in her mind, it is also seen in the immune system biology. And she decided to repeat again about 6 months after the test to see if this is a constant improvement, and indeed it was. So the biological age stayed low. So another example that the decision that she made is a good one, and hopefully this trend will continue. And this is it. I just wanted to, sorry, my dog is here making some weird noises. So I just wanted to encourage everybody that's not yet a partner to register as a partner. You are feel free to reach out to me or to Nicolina to talk a little bit more about this if you have a nice research opportunity for us, particularly on this topic. We would be happy to discuss it as well. So that's it from me. Nicolina, do you have some final words to say?
Yeah, unfortunately, we ran out of time. It would have been lovely to take in the questions, but I think what's then best to do, we're gonna follow up with any questions which were left unanswered. And on the research collaboration, there was so let's maybe continue sharing the screen until
Ah,
the end. But there's an email, partners@glycanage.com. So if you have an idea of a study that we can collaborate on, please send it forward. And yeah, we'll be very happy to explore it together.
I think we have another 2 minutes. So if Nicolina, if you want to address some questions or just a few rapid comments, you're, I think, free to do so.
So we have a few questions if we want to go on these. So there's one from Magnolia. Could you please discuss biological age outliers and explain the stress relief therapies, habits, and lifestyle practices they use to maintain a biological age? This is 10 years or more younger than their chronological age. You want to take this one?
I'm not really I'm not really certain what is asked here. So outliers, but where the biological age is decreased. As we mentioned, we don't have like particular findings from the studies, but we do have a lot of clinical evidence, as I've shown in the last examples, of certain interventions that the individual kind of feels that they need to do, or it just makes sense to them, or they talk to a professional to help them develop these protocols. And we've seen the biological age just decreases, but unfortunately we don't have a proper set of recommendations that would work uniformly in most of the individuals so far. Nicolina, do you want to add something?
So there was an interesting case study. You had one and I had one, but we didn't have time to include them. So I'll talk about my one. So usually when we look at individuals who are in high stress environments, entrepreneurship, corporate, and this was actually politics. It was a politician, and we were expecting, and we tested a group together, and all of them were high, apart from one individual. So this is maybe 10 individuals and one outlier. And the outlier had balance that the others didn't, where he had a private life, which was secretly private, and he had like in a way, a little, like he would go to his family on the weekend and just kind of that would give him balance. And then he'll go back on a Monday and do whatever he needs to do at work. So what he credited to was his family. And I think we've noticed that the individuals that have a very healthy and in many cases, for some reason, private family life, they seem to have more balance than the
Yes.
ones which are in turbulent, which are not, well, let's not we
Yeah.
don't have enough evidence to say
Yeah.
anything really, but this was one outlier. Others that kind of credited his family life for the balance
Mm.
and his good GlycanAge.
That's a good point. And I also had cases where, in this environment of investors that all show this manager's profile, there would be one outlier that is just not showing any signs of that. And when I would talk to that individual, the same would be true. So they report having a very stable life, a support group, whether it's family, whether it's friends, but a support group around them. They would also, so when we talk about like health priorities, mental health would be their priority, like non-negotiable health span therapy would be mental health, like sessions, breathing sessions throughout the day, meditative sessions, gratitude sessions, oftentimes, and kind of diet optimization and exercise optimization would come second and third. So those would be the most common outliers that we see. Thank you all for those positive comments. I really appreciate every one of you. I appreciate you staying for such a long time. We have so many people staying. So thank you. Yeah, we have some poll showing, so feel free to answer it. Nicolina, do you want to take any more questions, or do we just reach out to everybody after this session?
There's one more from Valerie on I have seen positive impact on PTSD and stress management with daily practice, free a day of cardiac coherence. Unfortunately, I don't know what it is. So I wouldn't say we have studies because, yeah.
No, we
Well,
don't have studies on it, but we have shared the studies on PTSD and depressive disorders. We do have more studies on those subjects where signals are maybe related more to the plasma protein, which we don't directly have in the consumer report, but we definitely see that the glycans are biomarkers to evaluate the PTSD and stress response, but I'm not really sure. We don't have anything that would connect this with the cardiovascular risk, if that was the question that was asked.
yeah.
Oh, oh, I see. So cardiac coherence is an alignment of the heart rhythm and respiratory rhythm, which activates the parasympathetic and nervous system. Well, actually, on that subject, we are collaborating at the moment with a device that activates the vagus nerve, and we want to see, so it's an internal pilot study, but we are measuring the GlycanAge before intensive session with that device and a few months later. So we hope to see an early signal. So that would be, no, it's not NeuroSim, it's a different device. But I think it works on the same mechanistical background. So we will have the first findings in, well, hopefully very soon. And this is definitely, no, it's not hard math as well. We will publish. I'm not really sure if we can disclose which device actually is. I have to double check that, but we will share the findings hopefully soon if we see a signal. But that's one of our efforts to explore potential protocols to have in our arsenal in these types of situations. Yeah, I'm having trouble seeing all of the questions.
Yeah, some are in the chat, some are in the questions. So I also a comment from Florence. I'm doing a study. So Florence, I'll email you. Let's see what we can do. But Yeah, I think if everyone who has an idea, if you send us your ideas, we'll be happy to have a conversation and see if we can do some pilots and some
Yeah,
small studies together.
thank you. And I hope that the team is going to preserve all of these comments for us to reach out to each and every one of you that is interested in further collaboration or partnership. I will also try to save this conversation on my side. Okay, I think we can wrap it up slowly. Thank you so much, everybody, for staying and for being so curious, for listening to us, for supporting us as well. It was a pleasure to have this opportunity on my side. Nicolina, if you want to say a final word.
Yeah, no, thank you everyone for staying. 1 hour is a long time, but yeah, we'll look forward to expanding this topic and yeah, hopefully having some interesting studies in the space. But we really appreciate your time. Thank you.
Thank you so much, everyone. Bye bye.